Welcome to Negotiation with Alice, your negotiation podcast. Everything that you do where you need to get on the same page with someone else is a negotiation. So whether you have to negotiate a contract with someone, or you simply need your boss to sign off on that program that you'd like to implement, or you want to figure out how to rebalance the chore structure in your home, or talk about what vacation you want to go on. All of these things are negotiations. So in my podcast, we go over both personal and professional conversations, which all are considered negotiation, and I will give you tips on how to come out ahead. Welcome to the show. Welcome, listeners, to another episode of Negotiation with Alice. I'm very excited to have Michael Westgate here today. Michael, welcome.
Thank you very much. Glad to be here. I'm what's called a neuromuscular therapist, and I'm an expert in treating injuries like rotator cuff or frozen shoulder, back pain, but I'm also an expert in treating chronic pain. And chronic pain is a much more complicated thing to treat because it has to do with the central nervous system and it has to do with it being stuck in places that are hard to get out of. And I use a variety of techniques, both hands-on and some other advanced neuroscience techniques to help people with those issues.
And what's your question today?
So what I was curious about, because here's a challenge that I face every day in my practice. People come in who are injured or very ill from chronic stress. That's the chronic pain. And my experience in my practice for almost 25 years is that the best way to get better is to adopt self-care practice routine, ongoing, where you will work towards your wellness through, there's a variety of things you can do. And it depends on what's wrong. Like someone has a shoulder issue, well, I'm going to give you shoulder exercises, stretches, and self-release techniques. But, if someone has chronic pain, then they're going to have to do stuff that brings their nervous system back into balance, which could include a mindful practice, but there's a lot of different options, including a recent one I've discovered, which is cold exposure, so ice baths and things like that. But here's the rub. But most people, it's really hard to get them to do anything consistently outside the office. And, I'll talk to them about it, and I'll make suggestions, or I'll try to negotiate what it is they might try, but it's not easy. I would say that typically, even for people that are in horrible situations, that less than 15% actually succeed at doing those practices consistently. So that's the issue.
So basically, it's not just you negotiating with them. It eventually becomes them negotiating against themselves, right?
Thank you for that clarification, but that's exactly the problem. Is that and let me say one more thing before you go on, because this is a very fascinating thing that I've discovered about the neuroscience. We have our subconscious system, which actually runs our lives most of the time. People don't realize that, but most of your decisions are made by your subconscious. And that resides mostly in the body, not the brain. The body has a lot of neurological tissue in the gut. And when someone's trying to get themselves to do anything at all, you're actually negotiating with that part of yourself that has most of the control. And so it's the part that usually refuses is the subconscious system. And because it doesn't actually like what you're trying to do or how you're doing it or something. So that's great. So yeah, let's go on that track. I like that.
Definitely. So I'm very familiar with what you're talking about, and I've experimented with it myself, where you tell yourself, let's say, for example, I'm one of your patients and I come in and I'm telling myself, I'm someone who has chronic pain, right? And so then that subconscious person that you're referring to is always negotiating against the person who's wanting to become healthier, because the person that my belief system is like, well, I'm the person with chronic pain, so why am I going to go do all these things to get better? Now that sounds weird, but it's what's happening. So I've told myself before, when I try to change my habits, I told myself, okay, you are, a triathlete. I used to be a triathlete, actually, but I tell myself that now. You're a triathlete. And I notice that in the moments when I'm trying to wake up to go exercise, it's easier because I'm trying to change that subconscious person. to say I'm a triathlete versus, oh, I'm somebody who like can't lose weight or I've got chronic pain. Because when I tell myself that that is who I am, it is significantly harder to wake up in the morning because I'm negotiating with a very fierce person who is convinced that this is the way it's going to be. I'm resigned. This is the way it's going to be. So then the micro decisions of like, do I do this for 30 minutes? Do I get up and do I get up 30 minutes earlier just to do the exercise or the stretches? Or do I get up 15 minutes earlier so that I can make myself a healthy breakfast? All those micro decisions all day long go in the right direction if I tell myself who I am, like in a healthy version, versus if I tell myself, well, this is sort of like what I've got. I'm older, I've got chronic pain, then all my micro decisions go in the wrong place. They turn to direction.
I'm not good at working out. Or, right, this is,
yes.
Okay, I like this because one of the things I've been thinking about doing with people is having them come up with a very specific vision of where they want to go. So that, because that's a recent thing I thought of, because I understand about, goal setting, or well, here's a distinction that I've learned recently from my research. If you have a goal that has an end point, like I want to make $1 million or I want to lose 5 pounds, that's not the best goal because when it ends, you're lost, right? So if you have a goal that's in a sense almost unattainable, like I want to be a kind and loving person, well, you're never done doing that, right? So maybe I can have them do something like, okay, well, imagine, who he would want to be if he were vibrant, and say, I see myself, I'm an energetic, happy, engaging person. Okay, well, that's something you can work on for your whole life, right? So that's perfect.
Yes.
And then say, okay, from that person's point of view, what do you want to do to get better?
Exactly.
Which of these things I'm offering you to get? I like that. That's a really nice framing. And it also puts into their court, which I want to do anyway. I want it in their court, right? Because their court is where it happens. I mean, I don't show up every day and say, we're going to do your practice today together. They need to have that orientation. And there is an element too, and I'm interested in your opinion about this, since you do understand the neuroscience too. There is an element, the two elements that I see. One, humans hate change. I think that's one of the
yes.
And I would say the subconscious system mostly.
Yes.
And also, I have a hard time finding people that are willing to work on themselves. I think partly because I think there's a lot of self-loathing or lack of really self-love involved in most people's psychology. That would be my interpretation. Do you agree with that?
So there's many elements. So yes, to an extent, yes. So there's a lot of layers here, right? There's the subconscious person that we think we are. There's that going on. There's the self-loathing that many people just carry around with them. So that basically sabotages anything you're trying to do. And the third piece of it is that I know they say, oh, it takes 21 days for, habits to take place. I have experienced some habits take 6 months to kick in. That I fight and I fight and I fight. And 6 months later, I'm like, oh my gosh, I finally got it. And most people never get to that point to understand that they're able to change it because they may try for a week, they may try for 21 days, and then they say, you know what, it didn't take. But from my experience, it takes significantly longer if you're going to make a significant habit change.
Yeah, I agree with that 100% because one of the things that I have framed in my course and in my practice is that self-care practice should become a permanent part of your life for the rest of your life, especially if you have chronic issues, because your nervous system is already wired against your wellness. And if you think you're going to fix that in 2 months or even a year, it's really not realistic. And, not to mention that it's an interesting thing to note that if you look at any tradition of awareness or wellness, so you've got Buddhist practices, even the Christians, the Muslims, everyone has, there's a prayer schedule, there's practices to correct certain ways of thinking, there's chanting. All these things are actually physiologically solid in terms of helping shift things. But the thing is, if you're a Buddhist and you're practicing mindfulness, or you're just practicing mindfulness, some of these people, they tell me, yeah, I've been doing it for 25 years and I'm still discovering new things. right? I'm going to new levels, even now. And I'm like, yeah, that's my experience as well, is that the reason it's worth committing is the same reason it's worth committing to the right kind of relationship, because you're not going to know someone in 6 months. You don't know yourself in 6 months, right? You
Exactly.
don't know the depths of things. There's no nuance if you don't go for the long haul. And
Well,
it's the other thing. If you love someone, you just love them for a little while and then stop.
right. And people are
No.
changing, right? I mean,
Hmm.
if we're older, like in our 50s, we're not the same people we were when we were 20.
Absolutely not. Different concerns, different orientations, different issues, different worries, right? Yeah, and that's, this is the thing that the reason I formulate this way and why I think it's so important to help people find these rhythms is because everything's shifting. You're aging, the world's changing around you. People around you are changing, right? So it's like everything's shifting. It's not like you can get one mode of being and just stick with it for your whole life.
Right.
And that's it. No, it's like, it's not like you can't just work out one day and you're good. It's like you have to keep on engaging,
Yes.
right? And reorienting and having new modes of being develop within you so that you can adjust and adapt. Because by the way, the main issue with chronic pain is a loss of adaptability. So that's the issue. And it's true about, all mental illness is often the same thing. It's an inability to adapt. And so you're stuck in a mode of survival that is, maybe been a good idea when you were young or something, or in one instance, but it doesn't serve you across the board. So you want to be able to shift and adapt
Yes.
and
So
practice.
exactly. So one of the things that I do when I'm mediating is I really trying to change people's perspectives by maybe 2 degrees, because if you're seeing something like at a 2 degree difference, your outcome where you go is vastly different over time, right? So in
Yeah.
the same sense, I feel like the things that work for people in their 20s and 30s, whether it's the way they eat, the way they exercise, that sort of thing, it shifts later. But I feel like people are still relying on the models that they had earlier, saying like, well, but if I worked out really hard, I was able to lose weight, or I could eat whatever I wanted and I could lose weight, or whatever it is, right? Or not
Yeah,
have
right.
chronic pain. But the models, like you talk about, the models are shifting. But I think what's really important when you are the one negotiating with your client, not when they're negotiating on their own, is to try to get them to shift that perspective that their bodies, even though it's still their body, it is going to be a new model. So you have to figure out new ways of eating, new ways of
Uh-huh.
care, new ways of working out, because going really hard may not be the thing, because you're going to break things as you get older
Yeah.
because you have, more fragility. So I think it's very important to talk about, hey, we have to basically do a reset about everything you've known about your body. It's not the same as it was when you were 20. And so we need to like refigure out the plan of what works. And then if there are too many habit changes, you probably need to help them figure out a plan where they implement small bits at a time and
Yeah,
make it manageable over the long haul.
the small bits is already part of my deal. Because I understand from the neuroscience too, is that you really should start a new goal smaller than you possibly can think is reasonable,
Yes.
because otherwise you probably won't continue doing it. So I actually call them pocket practices. They're practices that are easy to remember, easy to do, and you can do anywhere. That's what you start with. And it's like you have it in your pocket all the time. That's why I call it that. So that's a really good, but the point you just made is really helpful, the framing, because I think that's what I'm trying to do, is I'm trying to frame it in a way where they can see where they're at and why they're struggling, and then realize, oh, there's a better way, and I can shoot for another way of being, which is appropriate now for the fact that I'm not 21 anymore and I'm actually 60 or something. And that will lead to a better outcome. And I have to shift my perspective for that to happen. But it's even logical, not that logic necessarily shifts things for people, but it can help. I mean, it's an element, but of course the emotional salience is that's the other part that I'm trying to figure out, is how to frame it for people, like without scaring them too much, but saying, look, if you keep doing this, you're going to end up in this ditch over here, or you're going to stay in the ditch you're in. But, there's this other way, there's this other hope. over here or high up, and let's go towards that together. Let's gradually and, kind of lovingly and gently move our way towards this other way of being that will help you heal.
Yeah, I think maybe in your work with your patients, you have them sit down and really try to imagine who is it that they want to become? Who is that person? And so what you're doing with that short exercise is trying to change that subconscious that's running in the background all the time. So it's kind of replacing it. Obviously, the old persona may still be there, but the more that they can really focus on the new persona, the person I am, it's not who I want to be. It's who I am. And you project that future person into the present to say, I am a triathlete, I exercise, I eat well. And you have them say this mantra in the mirror out loud every morning, because the brain perceives things differently when it hears the words out loud rather than just hearing the thoughts, right? It's kind of like Dr. Daniel Siegel, you and I talked about, who is a psychologist, very famous psychologist. He talks about the neuroplasticity. Your brain can change. Like, you can change the pathways in your brain. And so you want to be able to say things out loud so that it hears it. And then it's now processing the words that you're saying. So if you say that, then you can also ask yourself, what would that person do today? Right? What would the healthy, vibrant Alice do today? Would she choose to eat chips, or would she choose to eat an apple? And those micro decisions last all day, as long as you can continue to tell yourself, I am this person, and you bring that healthy, persona into your mind.
Yeah, it's like the archetype. You're shooting for an archetype that you're embodying. I mean, one way of putting it also is I'm curious who I'm becoming. I mean, that I've heard that recently, and I kind of like that some ways, because sometimes my brain says bullshit to the I am. But if I say I'm becoming, and therefore what can I do right now to become that more, is also. But I think they both work. But that's a really good frame. I like it, and I think that I can implement that immediately.
That's awesome. I mean, I've tested that on myself, and I noticed that I do make different decisions based on whether I'm telling myself that I'm this healthy person versus I tell myself like, oh gosh, I'm just never going to lose weight. I've been trying and trying for years. You know what I mean? If I tell myself that, which most of us tell ourselves like, oh, I've had this chronic pain for years, or, oh, well, I guess this is what it means to be an older person, right? People are always, you got your own tapes running in your mind, but people don't realize how powerful those tapes are and how they can hold a grip on you and hold you back from reaching your goals, as long as you allow that tape to like make all your decisions for you.
Yeah, it'll run you. I mean, it's, whatever story you're running is what your story will go towards. And I think it was Carl Jung that said, you want to be aware of the myth you're living and wonder and ask yourself if you like what you're living, because, it might be a tragedy. Right.
Exactly.
And if you don't want to live a tragedy, why you change your narrative to one of a hero or something like that is very helpful, I think. And because that's what will possess you. So whatever it is that I heard it said another way from a psychologist recently. He said, ideas possess people, not the other way around. And he said, so whatever ideas that you take into yourself, they actually live through you. I thought that was very helpful.
Yeah, I like that.
Kind of another way of what we did. I mean, it's another way of saying what we just said, but I thought that was interesting. Or they possess you. That's actually, he was saying that modes of being will possess you and take you where they take you. So he goes, be careful what you invite in.
The other thing that's helpful is, and these are just tools that maybe you can share with your patients, is to not beat yourself up because you had a bad day, right? If you missed all the things, you don't want to tell yourself, okay, well, I give up because I screwed up 2 days in a row. No, every day is a new possibility. So if you messed up the last 2 days, who cares? I'm always like, focus on the day ahead of you. Focus on the day ahead of you. Like, if you messed up, okay, fine. Tomorrow we get another chance. Because I feel like a lot of times people beat themselves up and they're like, well, it's been 3 days, 4 days. I might as well give up. I can't do it. Or, you know what I mean? But if you just tell yourself, no, I'm going to keep on thinking about that persona. I'm not going to let that person down. and I'm going to show up again. It's a new day. I get a new chance. Because like you said, this is a lifetime exercise, right? So why would you give up on a lifetime exercise?
And it's your life. That's the most important part. It's not some abstract. It's like, it's your daily experience.
Yes.
It's your way of being in the world. And it's like, if you, how would you like that to play out? You want it, again, do you want it to be a tragedy, or do you want to be a hero that overcomes? Because there's the options right there. And the nervous system, it's an interesting thing is that nervous system a narrative machine. So what I understand about trauma, which is what chronic pain is usually related to, by the way, is that you have an event in your life that the story ended poorly, which means you didn't know how to navigate it into a successful end. So what you do is you have to renegotiate the memory, which is the story, so that it ends differently. So instead of it, so that it's like a fairy tale, and they all died. That's the end of that's the end of the tragedy story, or they were imprisoned or overpowered or crushed. And what you want to change that to is something like, and that the hero, you, faced the dragon and overcame it, and then brought the treasure back to share with the community. So that's the other narrative. And I think in every case, this is my experience with people, is that, part of the healing is renegotiating your story, so that when these challenges come up over and over again in your life, you become the hero instead of the victim of them, because they play out over and over again. It keeps playing out until you address it or not. Gets louder every year, by the way. That's the other thing. If you don't address it, it gets louder and louder. Symptoms get worse and worse, because there's a request there from the system. Right. I need this to be addressed. I need this to be integrated, and it isn't, and it gets louder. Yeah. And if you keep denying it and running from it, then it gets louder. It's like,
well, I always like to say that your body talks to you through pain.
Yep.
And so if you don't listen to it, it will only speak louder and louder. So more and more pain is just your body trying to say, please listen to me, because you're not listening to me. So it's really important to be aware of that fact. And I think that, the whole, no pain, no gain is not really a good way to live, because it basically trains people not to listen to their bodies when there's actually something going wrong and something wrong with it, whether it's trauma, whether it's an injury, any of those things. It
illness
really
of any kind. Yeah. I mean, I also say that, especially with chronic pain, now, acute pain, that's actually a signal of damage, but beyond acute pain, which means if it's chronic, it's 3 months or more, and is that what I call it? It's a request, not a punishment. That's what I see it as. It's a request that you can't hear or you don't understand. So, what is the request? Well, you're going to have to do some practices to hear it. I mean, you're going to have to spend time with yourself, God forbid, intimately. Oh my God, and actually be with how you feel and how you are for more than 2 seconds on a regular basis.
Well, the other thing I want to mention too is grit is really important, because most entrepreneurs, the ones who are super successful, they failed. But the difference between them and the other people who do not succeed is that they kept getting up, and they kept getting up, and they kept getting up. So in the same way, if someone has that persona and they're thinking about that person who they are becoming, if they fail, they should just know it's going to just take grit to get me to where I want to be. So it doesn't matter if you fail 100 times. If you get up 100 times, you will get to your goal.
Yeah, I agree with that 100%. That is, but it's interesting distinction though, because people confuse grit with toughing it out. Because there's a toxic element of ignoring oneself and just pushing through. That's not the same thing as, like you said, oh, I missed the mark. Because it's not really failure. It says I missed the mark. I need to aim again. Try again. Oh, I missed it too. But what does that tell me about how I have to aim? That's what it actually.
Yes.
If you have a growth mindset, what you're saying is, oh, I shot the arrow and it went wide on the left side. That means the next time I should shoot more to the right. And then eventually you get on the target, and then eventually you might actually hit the bullseye. But you won't if you quit. Right. Every time you miss them, oh, I failed, and there's that story again kicking in. And it's like, no, but remember, the person you're becoming is a person that doesn't give up.
Right. Right, exactly. So if you keep that person alive in your mind, then it'll definitely help with all of the micro decisions that you make throughout your day, I think.
Yeah, that's helpful. That's very insightful. Very good. Thank you very much for that.
You're very
And
welcome. Thank you, Michael, for coming on the show. This was a delightful conversation, especially because we're using a lot of like neuroscience, which is something that I really, really enjoy talking about. So I appreciate you being on the show.
yeah, welcome. And yeah, it's nice to nerd out with someone that's into these same perspectives. Yeah, I appreciate your time, and the opportunity to discuss this.
Awesome. Thank you so much. And listeners, thank you so much for tuning in to another episode of Negotiation with Alice. Until next time.